Breaking news is first at 5 tonight. The state health department says Ohio has just registered the largest single-day increase of COVID-19 cases since this pandemic began.
12,502 cases reported in the last 24 hours. The data showing we are in the midst of a new wave. Take a look at those numbers there. The 21-day moving average approaching 8,500 now. To date, the state has documented more than 1.8 million cases.
President Joe Biden laying out his playbook to tackle this new Omicron variant. The CDC says the variant accounts for more than 73% of new COVID cases.
The president now planning to send out kits to households across America as COVID testing locations like this one in Florida today become hotspots all across the country.
Well, President Biden's plan is a three-prong approach: support hospitals, free testing, and expanding vaccination access.
Supporting hospitals include 1,000 more troops. FEMA response teams are getting involved and preparing supplies to ship.
Free testing involves access to federal testing sites, free rapid tests to households, and accelerated production.
The federal government will purchase 1/2 billion. That's not million, billion with a B, additional at-home rapid tests with delivery starting in January.
Now, finally, expanding vaccine access involves pop-up clinics and additional vaccinators, including the possibility of interns. Now, we have live team coverage of this big announcement today. We have both Clay Gordon and Kevin Landers covering Ohio's response to the Omicron variant.
Well, the strain is real. The toll is adding up. That is the message tonight from some of your family, friends, and neighbors who work on the front lines of health care. 10 TV's Kevin Landers delivers their plea to the public tonight as the state prepares for the new COVID wave.
Frontline nurses came to Columbus Public Health to share their stories about working with patients with COVID-19. They shared stories about seeing their patients die despite a vaccine that could save their lives.
These nurses and doctors came together to sound an alarm.
I can speak for all the EDs in Central Ohio. We are completely full.
Emergency rooms full of COVID-19 patients, many of whom they say are not vaccinated. Doctors fear the worst is coming.
And that's shocking to say, given what we've seen since March of 2020. This is going to be serious over the next 2 to 4 weeks, and we need to be prepared for it.
Nurses say they are at their breaking point, trying to care for more patients with fewer nurses because they are getting sick too.
When nurses are burnt out and at the end of their wits, we're not effective caregivers. So you can't pour from an empty cup.
It's breaking my heart. It's breaking my heart every day going into work and continuing to see people die when I know that it could be prevented.
That prevention, they say, begins with vaccinations. Nurses say the COVID deaths haunt them.
I have had to hold an iPad and hold a patient's hand while they died so that their family could be with them. I've experienced more death than I ever thought I would in my career.
Which is why they gathered now, 4 days from Christmas, to plead with people to get a COVID-19 vaccination, with the hope it may possibly keep another person from ending up in the emergency room.
This is the time to go and protect your fellow man here. The only way out of this pandemic mess is vaccinations.
According to Dr. Mashika Roberts, in Franklin County, 40% of the population are not vaccinated. Kevin Landers, 10 TV News.
Now, we're hearing from the Ohio National Guard following the governor's decision to deploy about 1,000 members of the Guard and Air Guard to help with Ohio's already strained hospital system.
10 TV's Clay Gordon joining us live in studio tonight with details on what this means for the state and Central Ohio specifically. Clay.
Andrew, Yolanda, Adjutant General John Harris, he led a news conference today about the deployment of the men and women of Ohio's Army and Air Guards. Major General Harris says the focus of the 150 medical and 900 non-medical members will be on the Cleveland and Akron area for now. Now, this is a public testing site open today at the W.O. Walker Building in Cleveland's University Circle. Now, according to our affiliate WKYC in Cleveland, it stopped accepting patients due to high demand today. Major General Harris believes we will see a significant presence in hospitals starting Thursday.
Medically trained guardsmen, where are they coming from, and what hospitals do you think are the most trained and they'll be going to?
Well, The specific hospitals, I couldn't tell you that. We're working with Department of Health and who's also working with the Hospital Association to get the best data that they can. And it's going to be fluid. We know, especially as Omicron increases and moves around the state, we're building agility so that we can shift based on where the most demand is.